hand sanitizer. How you doing?
Good.
Good. My name is Marissa. I'm going to be your nurse today.
Okay.
Can I do a quick check here? What's your name and date of birth?
Jessica Smith. Date of birth is 8/17/1989.
Perfect. How are you feeling?
I feel good.
Okay. What brings you here today?
Just need a physical assessment for school.
Okay. All right. So the way this kind of works, we'll do a head to toe, check everything out, listen to heart sounds, lung sounds, all that good stuff. We'll do some vital signs, get some blood work, and kind of go from there. Okay?
Sounds good.
Any medical history?
Just asthma.
Asthma. And how often are you taking your inhaler?
Every once in a while, usually when the weather's bad.
Okay. Have you needed it more recently?
With the rain, a little bit, but not in the past week or so.
Okay. If you need to take it, it's best to take 2 puffs at a time.
Okay.
With 1 inhalation, hold for 10 seconds, let the medicine disperse into your lungs,
Okay.
and then release. Take another one every 4 to 6 hours. Okay?
Sounds good.
Any allergies to medications,
No
pets,
allergies.
anything?
Just allergies to like seasonal allergies.
Seasonal allergies. Do you take anything for that?
Just like an over-the-counter Claritin.
Claritin, do you take it every day?
Just as needed when my allergies kick up.
Okay. For that, just make sure you try to take one every day. It just kind of seems to work a little bit better, building up tolerance in your body. Okay. Any family history?
My dad has a history of high blood pressure.
Okay.
And my mom has asthma. That's
Asthma. Okay. Okay, no heart attacks, strokes, anything like that in the family?
No.
Okay, everybody's still alive and healthy?
Yes.
Awesome. So patient looks well to me, non-toxic, non-diaphoretic, skin looks warm and dry, pink, hygiene looks like she's takes good care of herself, posture's good, everything looks symmetric, no facial droop or anything at this time. And so we're going to get some vital signs, okay? I'm going to put this blood pressure cuff on you. Okay, blood pressure is 120/72. We'll check a heart rate. Heart rate is 70. Oxygen saturation is 100% on room air. Temperature was taken up in the front triage is 97.8 and 18 respiratory rate. So right now we're going to go start the head to toe. Okay. Any pain when I touch your head here?
Nope.
Okay. Any pain on your neck?
Nope.
Perfect. Her scalp looks nice and clean. Looks like her hair's nice and healthy. You get lots of haircuts?
Yes.
Perfect. Any loss of hair recently?
Nope.
Okay. And then while I'm checking here, I'm going to check your lymph nodes.
Okay.
Any pain?
Nope.
I'm going to check lymph nodes under your arm. Any pain here?
Nope.
Okay. And I'm going to palpate for your sinuses. Any pain?
Nope.
Perfect. Okay. I'm going to next do a funny test with a light. Okay. This is a pen light. It basically is just going to allow me to look a little bit closer. Okay. Go ahead and take a look at me. Perfect. Eyes are pearl. Go ahead and follow my pen here. Perfect. EOMs are intact. At this time we would do a visual acuity test. Do you wear glasses?
No.
No. Okay. All right. So we would do this at that time. I'm also going to look in your ears. Outer ears look good. Inner ears we use an otoscope for. They're in a good position. We'll look at this ear. Left ear looks good. We use otoscope to look inside as well. No redness or anything like that. I'm going to look in your nose. Nose looks good. And go ahead and open up your mouth for me. Good. Can you say ah? Throat looks good. Go ahead and stick out your tongue. Move it side to side. Perfect. The next kind of funky test we're going to be doing is to check your neurological status, your cranial nerves.
Okay.
Go ahead and close your eyes really, really tight. Perfect. Open up really wide. Perfect. Puff out your cheeks. Good. Can you feel me touching here, here, and here?
Mm-hmm.
Perfect. So far, skin looks good, warm, pink, and dry. No facial dysymmetry. Speech is clear. She's alert. She's oriented. She's telling me everything appropriately. I'm going to have you do some shoulder shrugs.
Okay.
That looks good. Perfect. And we'll check your skin turner while we're here. No tenting is noted. Patient appears hydrated well. I'm going to check your lung sounds here. Okay. I'm going to look at her chest here. Looks good. Equal, symmetric. Rise and fall of the chest. No work of breathing. No retractions noted. We're going to just listen to all these lung fields. Upper lobes. Go ahead and take a deep breath. Perfect. Middle lobes are clear. Lower lobes sound clear. Next, I'm just going to listen to all of your heart sounds, okay? Just breathe normal. Okay, her apical pulse is her apical heart rate is intact at a rate of 72. Are you having any chest pain, shortness of breath, difficulty breathing, coughing, anything like that? Okay, perfect. I'm going to have you sit up and I'm just going to listen to your back, okay? Any pain along the spine?
No.
Okay, your neck, like I said, feels good. The sides of your back feel good?
Yes.
Okay, here we go. Take a couple more deep breaths. One more. Good. And I'm just going to check your kidneys back here. I'm going to palpate. Here we go. Any pain here?
No.
Pain here?
No.
Good. No CVA tenderness. Go ahead and lay back for me. Spine seems to be aligned. Normal curvature. Let's see here. At this time, I'm going to have her do a swallow test. Go down okay? Perfect. And patient is tolerating her own airway. She's able to swallow. Gag reflex is intact. No need to actually test it at this time. I'm next going to check your stomach. Any nausea, vomiting, diarrhea, constipation?
No.
No. How's your eating habits going?
Pretty normal. Trying to eat a little healthier, but not bad.
Good. You exercising okay? Perfect. Any change in your weight recently?
I lost like 15 pounds just from working out.
Oh, awesome. Sounds good. That's awesome goal. I'm going to just look at her abdomen here. Okay. Stomach looks soft and flat. Umbilicus looks like it's in the correct area. I'm going to listen here, okay? Bowel sounds are intact in all 4 quadrants. I'm going to do some light palpating. Any pain?
No.
Okay. That felt okay? Perfect. I'm going to do a little bit deeper palpation here. Any pain here?
No.
Good. No masses are felt. Abdomen is soft and non-tender. I'll check the suprapubic area as well. Bladder feels good, non-distended. Any pain with urination, blood in your urine, vaginal discharge?
No.
Okay. Menstrual cycles are normal?
Yes.
Are you on birth control?
Yes.
Okay. And any cramping or anything that goes along with that?
No.
Perfect. I'm going to check your hips here. Any pain on your hips?
No.
I'm going to check your femoral artery pulse here. Good. Those pulses are 2+ and intact. And then also feeling the lymph nodes in the groin area. They are non-palpable. I'm going to go and check your pulses in your brachial arteries here. 2+ equal and bilateral. And your radial pulses? 2+ equal and bilateral. I'm going to check your carotids here. 2+. 2+ and bilateral. And I'll listen as well. Okay, no bruise noted. Okay, and I'm going to check capillary refill. Good. And go ahead and squeeze my fingers. Good. 5 out of 5 strengthen. Upper extremities capillary refill is intact. Normal CSMs as well. We're going to do some range of motion next.
Okay.
Go ahead and lift your arms up for me. Perfect. And then do some circles. Awesome. Now we'll do range of motion of your biceps. Perfect. Elbows look like full range of motion. Go ahead and push against my arms here. Good, and pull towards you. Awesome, 5 out of 5 strength. We'll do some wrist movements here, and then do full round. Perfect, flex and extend, awesome. Range of motion of wrist and hands are intact. Next we'll move on to the lower extremities. We'll check the legs here. I don't see any pitting edema on either leg. Okay, skin is still pink, warm, and dry. No tenting is noted. Any pain when I was touching?
No.
Okay, perfect. Can you lift this leg up for me? And then we're gonna bend it here. That feels okay?
Mm-hmm.
Perfect. Let's lift this one up. Bend it here on your knee. Perfect. It felt okay?
Mm-hmm.
Awesome.
Okay.
Go ahead and pull towards you. Good. Push down like you're driving. Awesome. Can you feel me touching you okay?
Yes.
All right. DP pulse is intact. Pedal pulse is intact. Both of them are 2+ equal and bilateral. We'll check a popliteal. Those are 1+, bilateral and equal. I'm just going to check your skin turgor here. No tenting is noted. Capillary refill is intact, less than 3 seconds. We'll check this side. Perfect. No tenting on the right foot either. Capillary refill intact, less than 3 seconds. DP pulse is intact. And we'll do Babinski. Perfect. Good Babinski reactions. Next, I'm going to have you stand up and we're going to walk, okay? Go ahead and walk to that door. Come on back. How does that feel?
Good.
Good. Patient has a steady gait. Romberg test is passed. Go ahead and bend forward for me. I'm going to palpate her spine. Spine appears to be in alignment. Normal curvature. Go ahead and, is your hips feel okay?
Mm-hmm.
Perfect. Go ahead and stand up for me. Nice. Go ahead and take a seat. Okay, Jessica, so the next step is going to be just getting that blood work. So far, your exam looks totally normal for me. Your heart rate sounds good. Your lungs are clear. Skin's perfect. Bowel sounds are present. So now we're just going to have somebody come by. We'll draw some blood, do a couple chest x-rays, abdominal x-rays if needed. The doctor will come by and review all your results, and then hopefully you can get going home.
Okay.
Any questions?
No, not right now.
Okay, it was a pleasure meeting you. Thank you.
Thank you very much.